I became very unhealthy, particularly in my first year here. I gained so much weight, so much weight. And everybody thought they were doing me a favor by feeding me.
The Clergy Health Initiative is a 7-year, $12 million investment by the Duke Endowment that partners the Western North Carolina Conference, the North Carolina Conference, the Divinity School, and the Endowment in a program to help foster a culture of health among clergy. And we see it as an issue that strengthens churches, but it's strengthening the life of the church by helping pastors take care of themselves so that they can take care of their congregation.
If I'm not taking care of myself, you know, and I'm gaining weight, and all of a sudden I've got respiratory problems, I've got hypertension problems, I've got diabetic problems, it will lessen my impact on how I take care of the people that come to this place of worship, and individually, because if I'm going to be sick, you know, quite a bit, and I'm going to suffer a lot of health problems, how am I going to take care of my congregation? How am I going to tell them that they ought to be healthy?
Clergy health, I think, has probably, for many years, gone unnoticed. Methodist churches, as we well know, are great for potluck dinners and ministers being at the church night after night after night, making those hospital visits that were virtually unhealthy people.
Pastoral self-care is challenging because the ministry is such a unique calling. And often people who are drawn to that calling have a deep sense that their mission is to serve other people first and themselves second. The problem is the demands keep coming, and the times to take care of yourself keep moving further and further into the background.
I went for my spirited life physical. That was the real eye-opener for me, to go in, to do the weight check, to do the blood pressure check, the cholesterol check, and to realize that my numbers were bordering on a heart attack or a stroke. What was I to do with that? So within 24 hours, I was in the doctor's office. I was being prescribed blood pressure medicine and cholesterol medicine. I was told I had to lose basically 75 pounds. I wanted to live.
Initial findings from the Clergy Health Initiative have grabbed national attention. We now know with certainty that United Methodist clergy in North Carolina are more likely to suffer from obesity, chronic disease, and depression than other comparable state residents. One pastor in the study group hadn't taken a vacation in 18 years.
One result of the broad media coverage that our project has enjoyed is the focusing of a spotlight on something that the broader public didn't seem to understand before, which is how stressful clergy life really is, and how much more layered it is than the assumption that this is just a person who gets up on Sunday morning and leads worship and may spend a little time Saturday night preparing the sermon that they deliver on Sunday morning. The notion that pastors are as busy as they are, and the diversity of the demands on their time are as complex as they are, was news to a lot of people.
So spiritually, I have to be ready. Mentally, I have to be ready. Physically, I have to be ready. And the times that when we think that we got our own time to ourselves, oops, here's the phone ringing. And you never know what's on the other end of the call.